Recording. Okay. All right. Well, we're going to go ahead and get started. So thank you all for coming. Like I said, we got a few people on virtual. We're recording it as well. A couple of logistics. We're fine with you interrupting with any questions. We have time for questions at the end as well. We scheduled an hour and a half, and it's only about an hour of material. So there's plenty of space for discussion as well. So we'll start off with some quick introductions. Okay. I'm sorry, it's a very tiny projector for in-person people. We got this like last minute yesterday, so hopefully you can read it okay. The slides are also pretty information packed, and so if you want them, just email me afterwards. We have some business cards here and out front, so we're happy to share a copy of the slides. My name is Cole. I know several of you know me already. I'm a therapist in an adolescent residential treatment center currently. Just started that job. It's very different from psychedelic work, but it's awesome and rewarding in its own way. So that's at Embark Behavioral Health up in Greeley. I also keep a small private practice. So I partner with Mindful Therapy Group to take clients that need to use insurance and handle my billing and things. I also received my ketamine-assisted therapy training from Prati, the Psychedelic Research and Training Institute, back in 2022. I've also done training in psychedelic neuroscience from Psychedelics Today. I said psychedelics a lot, I'll say it a lot more. I also worked on the MAPS clinical trials, which is MDMA for PTSD, and MindMed clinical trials. So that was using LSD to treat anxiety disorders, generalized anxiety disorder. And I was mostly in more of a logistical coordinator role for those, but Shannon and I actually both got to sit for a live LSD session, which was pretty cool as part of MindMed. So I'll pass it off to Shannon. Get her in the camera here.
Yeah, and I want to back up too, and just people that are online or here. We're at Hope Roots today, and Sarah Joseph is so generous to let us use this space. And it is beautiful. You probably can't see it online, but yeah, check out her website. She has a nonprofit and she works with trauma here. So check that out if you're able to. I'm Shannon Darling. I'm a psychiatric nurse practitioner. I have an integrative private practice, which just means I use a lot of tools, conventional psychiatric medications, as well as a lot of things outside of that box. So my main part of my practice is working with ketamine. I do a lot of prescribing for therapists in the community, for their clients to practice ketamine with them. And I do ketamine with my own clients as well. I was trained by Prati as well, and I also continue to be one of their trainers. Yeah, I think that's all I'm going to say about myself.
Okay. So I'll talk a little bit about Integrative Care Collective as well. Several people in the room are already members, but of course, if you know somebody that would be a good fit, we welcome you to invite them as well. We're a community for mental health providers that are in a private or a small group practice, and we really focus on people who provide services to their clients that impact their clients' mental health. So keyword there is service. So usually it's therapists, coaches, even yoga teachers and body workers. Really, we try to be focused specifically on mental health. So we host educational workshops, as we're doing right now, events, networking, and Shannon leads a case consultation every Friday. Okay. So why care about psychedelics? Well, I really, really like this quote. So this is in the Colorado Natural Medicines Health Act, which I'll talk about in a lot of detail today. But the first time I read this, I was like, they captured it so well. So I'll just read it and talk a little bit more about it. So they said, Colorado's current approach to mental health has failed to fulfill its promise Coloradoans deserve more tools to address mental health issues, including approaches such as natural medicines that are grounded in treatment, recovery, health, and wellness, rather than criminalization, stigma, suffering, and punishment. And so I want to emphasize, we have a lot of great tools in the mental health world. Like I just finished up a 2-day DBT training, and I'm like, this is so helpful. I was stressed out yesterday because I thought I was going to have to go at my job today. I'm like, okay, I need to be in wise mind. I need to distract myself. So Shannon and I watched some Young Sheldon. So like, this is helpful. But we need more tools because Coloradoans be struggling. Like we're having a tough time out there. So yeah, and tools that are specifically rooted in like a health and wellness paradigm. So that's why we're passionate about this. And then just to kind of orient everybody to what we're talking about today, the purpose of the talk is to help mental health providers understand what psychedelics are as mental health care tools and to understand how to work with them. Okay, and I'll pass it back to Shannon.
Yeah, so I'm going to talk a little bit about the framework of how psychedelics work, just briefly. And really, this is mostly from a conventional Western standpoint, because that's how we are conditioned for things. So why psychedelics and why are they unique? They're an innovative approach to treating mental health care. We know as medicine, they have an immediate effect on anxiety, depression, and neuroplasticity. And neuroplasticity is just the brain's ability to rewire in different patterns. They're working a lot like conventional medicines on different neurotransmitter pathways, but in many ways, much quicker, more rapidly. And then they also, in larger doses, produce hallucinogenic effects, which from the conventional model is often seen as a side effect, but really in the psychedelic model is seen as one of the ways that they promote healing. Let's see, what else do I want to say about that? Psychedelics are unique in their ability to immediately, like I said, and powerfully also elicit mood and behavioral change, which differently than most other medications that can take weeks to months to really see the benefit, and then also you're battling side effects in between. So while they are unique in just their own medicinal properties, to maximize the therapeutic benefit and prevent harm, it's really important to understand the model of psychedelic assisted therapy. This is really used across the board with different types of medicines. So some of you might be familiar with it already. But you have three main parts, which are preparation, the actual medicine session, and integration. Starting off with preparation, the most important part before even beginning that is the screening, and that goes into the preparation. So if you're a therapist working with a client, understanding whether that client is appropriate, and then in many cases, conducting also a medical and psychiatric evaluation, another higher level evaluation to decide whether that client is appropriate or not, and in what form. And as we add new medicines, like what medicine might be appropriate for them as well. Preparation can be one visit before, especially if you've had a relationship with a client for a long time, or it can take many appointments to really establish proper rapport with a client before you ever start working with any medicine. So that's really important because people are excited. They want to get into this work quickly. They want the medicine very quickly, but it's very important to emphasize the time that it takes to build a relationship and start preparing the client to be in an altered state. Other parts that go into the preparation are things like logistics, helping the client understand getting a ride to and from the session, if they need to hold medicine that day, if they need to eat or not eat, things like that. So logistics are a part of that and preparation that are really important as well. And then there's the psychological preparation, helping them to start to build some intention and preparing them to be in an altered state and how they're going to use that for their benefit later. I always, when I talk about integration, say that even integration starts in this preparation phase as well. And then once you're ready, you can go into the medicine session, which is usually like the exciting part, right? And what people are wanting to get to. But there are a lot of things that as a provider, you need to be prepared for when you're considering starting a medicine session with somebody. One of the biggest pieces is time. Different medicines take different amounts of time to work with a client, and not giving yourself enough time can really set you and the client up for a failure and can be unsafe. So you can really do more harm than good when you aren't giving yourself or the client enough time to do the actual medicine work. And it's not just taking the medicine. During the medicine session, you're still bringing that prep piece in and helping them ground and prepare. And then afterwards, you're helping them process and making sure they're ready to go back out into the world. So that's another really important part of the medicine. And I find that especially people with busy practices can be really hard to figure out how to integrate that extra time into their schedule. So as exciting as using these medicines into therapy is, that can be a really hard part of thinking about preparing for. And then integration, this part can get skipped easily in the excitement of whatever comes from the medicine. But integration is really just what happens the day after, 2 days after, the week after a medicine session. This is the therapy that takes place within that really juicy neuroplastic window after a medicine session, whether it's a couple days to a week. It's the activities the client is engaging in, setting them up with different exercises and activities to really maximize the benefits of the medicine that they received. And then integration can happen for months to years afterwards. Insights come up from that. But it's really just intentionally continuing to pay attention and bring in those parts into the whole. While this is linear in practice, this is not linear. Sometimes you integrate and integrate and integrate before you go back to medicine. Sometimes you do a medicine session, integrate, and then go back into medicine. But really, this is constantly evolving as your work is being done. The examples of different psychedelics that are being used in therapy right now, and most of these are in trial, and most of this aren't legal yet for us to use. But just to give you an example, this is by no means an exhaustive list at all. I think the medicine that's being used most commonly right now in trials is psilocybin mushrooms. We're finding huge benefits in both micro and macro doses for people to treat depression, anxiety, OCD, eating disorders, end of life and existential concerns, and it goes on and on. I've even heard of a recent study they're doing at Johns Hopkins for Lyme disease, which is really interesting. So, yeah, by no means an exhaustive list, but some trials that have been done and are being done with psilocybin. MDMA, most famous trial most people know about is the MDMA for PTSD that MAPS has been doing. Having to go back into a third phase or a third, you say, yeah, the third phase trial, needing to do some more work there. So it'll be a while till we probably have that available again, but hopefully that's still coming. There have been some studies 20 years ago that were being done with relationships and attachment disorders with MDMA too. So promising for that as well. DMT, most commonly for treatment resistant depression. There's a study going on, I know right now for that. LSD, as we said, there's a study going on for LSD and general anxiety disorder right now. And then ketamine. It is currently FDA approved as S-ketamine or Spravato for treatment-resistant depression. It's being used off-label right now in a variety of settings for mental health and adjacent disorders. So depression, anxiety, OCD, trauma, chronic pain, migraines, kind of the list goes on. So I'm going to focus some of my talk on that, because that's what I specialize in. And we have it available to us right now and it's legal, which is really exciting. Ketamine is a Schedule III medication. So it is regulated by the FDA. It does require a prescription and a medical provider to give you that prescription. Has very unique medicinal properties, affecting NMDA receptors and glutamate channels, which is very different than most other psychedelics. And there is some debate, and I should have said on the other side, of whether MDMA and ketamine are truly psychedelics. I will leave that debate to anybody else. As far as I'm concerned, and the way that I practice with ketamine, I use it as a psychedelic in a therapeutic way. So, but yeah, ketamine has these really unique properties that we're really just starting to learn about, these receptors that we haven't paid attention to much in mental health. So that's very exciting. Ketamine really immediately affects mood and anxiety positively. And one of the biggest things that I've seen with people is the decrease or elimination in suicidality, which is pretty profound. Even when people maybe think they haven't got a lot from a session, it's pretty amazing to see those suicidal clients not feel suicidal anymore. And as far as I'm concerned, it's also a potent psychedelic medicine. And really, when I say psychedelic, it is creating this favorable environment to access deeper subconscious material. And so as far as I'm concerned, when I'm talking about psychedelic medicine, that's what I'm referring to. And once again, like the other psychedelics, it does create this neuroplastic window where people can make new and different connections to places where they might have felt stuck or stagnant as well. So how can your clients access ketamine? There are clinics that provide intramuscular or IV dosing of ketamine or Spravato. Pretty commonly, when you go to one of these clinics, you might have more access to using your insurance with Spravato, or just getting in quickly and getting a treatment and getting out. The limitations to these type of clinics is they often don't include the therapeutic aspect. You're just banking on the medicine to do the work. There isn't a lot of discussion and guidance for a client on what the other benefits are, except this medicine is going to help you feel less depressed, less anxious, etc. There are a handful of IV clinics in our area, and I'm sure in other places, and I know other providers that I've trained with that do offer therapy around IV ketamine. but it's pretty hard to find. Another way people can access ketamine is mail order ketamine companies. I mention it because it's out there. I personally have strong feelings about the safety of accessing mail order ketamine for a multitude of reasons. Just the lack of supervision and really the lack of direction on how to use ketamine in those situations. So whether using ketamine without somebody monitoring you or just really an understanding of how and why the medicine is working for you. I've also had quite a few reports of really inconsistencies in the dosing and how much people are really getting. So that could provide to be pretty unsafe if you were switching modalities of ketamine coming from a mail order company as well. I also think this has a huge potential for abuse. And financially, I won't go off on my soapbox, but there are some financial abuses being committed on people as well in this model. And then ketamine-assisted psychotherapy, which is really the model that I subscribe to and think is the most beneficial. There are different routes, obviously, to do ketamine-assisted therapy. If you have access to a medical provider, you can get intramuscular. I do intramuscular in my office with my clients. Or you are in a clinic that has therapy and IV, then that's an option. But my passion and kind of a realization that I made is it's much more accessible if I can prescribe for a client and they can take their medicine to use with their ketamine trained therapist. It does make it easier for them and more accessible for them. It also gives them an opportunity to maybe use their medicine with a provider that they have already built trust and rapport and a relationship with. Or if it is a new provider, they can continue to do work with them as well after ketamine. So, in this way, it's usually prescribed as sublingual or oral. It's really a combination of both those routes when you're using it this way. So once again, they would get a prescription from a medical provider. The client would have their own prescription and they would take that to their therapist's office. There are some limitations to that, obviously. Clients that maybe have some substance use disorder or just might not be super reliable to have a scheduled medication in their possession aren't going to be a great fit for this model. But in my 4 years of prescribing in this way, I can count on less than one hand how many times I've even had concerns or issues with that. So it goes back to the screening process as well. And clients or therapists know their clients pretty well and make that judgment usually whether that's a good fit for them or not. How can you become a ketamine-assisted therapist? While there's no specific licensure or training that is required by the board or by the state, it's really important that you are practicing within your scope of practice, right? Legally and ethically, to feel comfortable and really knowing and understanding what you're getting into when you're practicing ketamine therapy or any psychedelic assisted therapy is very important. If you're a therapist and you want to start doing ketamine with your clients, you're going to need a relationship with a prescriber. And prescribers might have a requirement for you to have a certain amount of training to work with. There are a wide variety of different training options. There are programs out there that just offer basic didactic trainings for you. So you can do 9 modules and be a ketamine assisted therapist. And then they also range up to the experiential models, which I highly value, where you're getting the didactic training alongside of an experience with ketamine and witnessing at the same time other people's experience with ketamine. Once again, I think it is crucially important, and I will only work with therapists that have some type of experiential training with an altered state, or just at least in the scenario that they've sat with other people in altered states before, to doing this practice. It is a very unique experience, and I think it's really important that people have some idea of what type of a state people are in to really do this work well. And to hold that vulnerability for them as well. If you haven't experienced it yourself, it's very hard to understand how vulnerable that place is. So even after training, I think another aspect is ongoing consultation. I can't emphasize how important that is, because training, most of the time we're talking about the positive outcomes and what we expect to happen. When you start doing this work, a lot of unexpected things will happen, and it's helpful to know how to troubleshoot those, or what to continue, whether to continue doing ketamine therapy with somebody, or how to continue it if you're running into different troubles. So meeting with peers or mentors that have experience or are working with ketamine as well is really important. There are also additional insurance requirements if you're practicing with ketamine that your liability insurance will want and need to know about. So, and not all of them will offer that. So it's important to know as well. And then once again, going back to the scheduling requirements, really, you should have a minimum of 2 hours per medicine session if you're working with ketamine. I know many providers that do 2.5 to 3 hours, or at least start off with longer sessions until they really see how the medicine is working in people's bodies. And like I said, really, even if you have somebody that's a rapid metabolizer, a minimum of 2 hours is pretty important to make sure that you can enter into the space well and exit the space well, and feel comfortable about them leaving your care after the medicine's over. How to become a ketamine prescriber. Really, this is the same as a ketamine therapist. There aren't any special licensure requirements to prescribe ketamine outside of your regular DEA license and prescriptive authority. I would just say, as a prescriber, there are inherent risks that are above and beyond, even though it's only a Schedule III medicine, and a lot of us prescribe stimulants that are Schedule IIs every day. Ketamine is a dissociative. It can be dangerous when it is not used appropriately and used with care. So really understanding the risks that you are getting into when you are sending somebody out into the world with that prescription is really important to understand. So once again, having adequate training is really important. And I think for a prescriber to have your own experience is just as important. And to be doing ketamine therapy with your own clients helps you understand how to prescribe the medicine well for others as well when they're not in your direct supervision. And once again, you're going to have additional insurance requirements and continuing to get ongoing consultation with other people that are working with this medicine, and not just prescribers. I get the most valuable information from the therapists that are working with clients about what's going on and how people are reacting to this medicine. So it's really important to have that integrative perspective as well. These are just a few training programs that I'm familiar with. There are many more out there. And once again, there are some that are very basic, but these are very comprehensive. Psychedelic Research and Training Institute Prati, I am partial to because that's where I was trained and I continue to be a trainer there. But they do a really great job. They have an experiential that lasts over 4 days, 5 days, 4 days.
5 days, 4 days.
Yeah. And they really do a good job at least preparing you to get started on that journey. Elemental psychedelics, another great one that's much the same format as Prati. One of their lead trainers or who started it started with Prati as well. So very similar in style. Women led though and developed. So that's unique and definitely brings that aspect of more feminine. Polaris Insight Center. They are actually out in California, but they do an asynchronous didactic, which is helpful. And then you can do the experiential, go out there for the experiential. Really solid people out there doing some solid work and really vouch for their program as well. And then I put the American Society of Ketamine Physicians, Psychotherapists, and Practitioners. Very medical model, not going to give you the therapeutic aspect really, but they have a lot of information and can give you a lot of really good knowledge about just the medicine. And then they will expand too into a lot of the other areas that kind of Western medicine is using it, like the chronic pain world and things like that. So. I'll let Cole take over from here now. Thanks.
Okay, I'm going to spend the remainder of the talk talking mostly about the Natural Medicines Health Act. I'm primarily working with psilocybin. So this was previously referred to as Proposition 122 when it was on the ballot a few years ago. And Colorado voters did vote to approve it. And now it's usually referred to just as Natural Medicines Health Act or NMHA. And the different psychedelics that were approved under this, I'll talk about kind of how they can each be used specifically, but broadly, this covers psilocybin. You may be familiar with the psychoactive component in magic mushrooms or psilocybin mushrooms, dimethyltryptamine or DMT, which can be smoked for like a short 15-minute experience or an IV, or it's also used in ayahuasca for much longer, kind of 4 to 8 hour ceremonies. Ibogaine, which is kind of in its own league, and mescaline, which is the psychoactive component of peyote. Importantly, though, peyote is not legalized because it has its own kind of special religious classification. So essentially, the NMHA established two pathways to access psychedelics. One is the personal use pathway, and the other is the regulated access program. I'll give you a lot of information about those. So currently only the psilocybin is available under the regulated access program. And I understand all the other ones are technically available under personal use. But psilocybin is the one that most people are talking about right now. Ibogaine could be added at any time if the board approves it, but if you're familiar with ibogaine, there's a lot more safety concerns. So my understanding is they kind of delayed things with that a little bit. DMT and mescaline could be approved after June 2026. It was written into the measure that they want to make sure kind of like everything goes good with psilocybin, and then they'll vote to bring those into the regulated access program. And then a very important just disclaimer, this is not legal advice. I'm going to talk a lot about laws and regulations, but don't follow my advice. If you're going to work with these, I recommend consulting a lawyer. I will provide the information for a great one at the end of the talk. So Personal use allows you to grow psilocybin mushrooms in your own home if you're over 21 years old. Of course, you have to keep them away from children, people under 21, so just be mindful of that. And you're also allowed to share them with other adults. You can drive around with them in your car, just keep them away from the kiddos. Importantly, though, you cannot sell them. So when we're talking about personal use, it's actually written into the definition. These are intended to be used sort of for purposes of counseling, spiritual guidance, beneficial community-based use and healing, supported use, and then there's some related services, which I'll talk about. But again, you cannot sell them. You cannot give them away as part of a business promotion or activity. So I'll talk a little bit more about that. But, the obvious loophole of like, I'm going to sell you something and then the mushrooms are a free gift is pretty explicitly not allowed in the way that the laws are currently written. And you cannot paid advertise those services either that are intended to be used with the sharing of natural medicine. And I'll talk a little bit more about what that looks like in practice. But an example of kind of going too far with this, I heard this from Josh Capel, who's a lawyer that co-authored the NMHA. He told me about a store that opened up in Denver and they were selling tiered harm reduction services. So, you get a little bit of harm reduction and a little bit of mushrooms, and you get some harm reduction and some mushrooms and a lot of harm reduction, a lot of mushrooms, but really it was just obvious they were just selling mushrooms under the guise of harm reduction, and the Department of Revenue gave them a cease and desist, so they had to shut it down. So just be careful about that stuff. You can donate them. You can gift them, as I talked about. So if you grow some and you want to share them, as long as you're not getting money for it, feel free to do that. There's also this section written in about bona fide services, and bona fide in legal speak is basically just good faith, meaning that you're not, trying to twist the words to kind of like find your loopholes. So you can charge for bona fide harm reduction services, therapy services, and other supportive services. So this could be sitting for the medicine, preparation, integration. You can share materials, educational materials related to natural medicines. You can have a website about natural medicine. So if you want to kind of disseminate information, you can do that. So this is kind of where it gets more into my interpretation. So again, consult a lawyer. I'll say different people have different risk profiles as well. But the way that I understand this is that personal use is really meant to kind of protect those existing like community healing structures that are already out there. So for example, I attended an ayahuasca ceremony a couple of years ago. It was all underground, definitely illegal. But under this personal use pathway, that you are allowed to kind of charge money for the fact that facilitation is occurring. There's places you can sleep, there's snacks. So basically, all the people that are putting on the ceremony are receiving some money in exchange for the energy that they're putting out to support that. But they're not technically supposed to give you the psychedelic still. So it's a little bit like weird if it's not totally clear. I would say the way I interpret the law is they're still not allowed to give you the ayahuasca or mushrooms or whatever. So the way some people get around this, for example, is by like having a bowl of mushrooms that are their free mushroom bowl at their clinic, and like you can take some of those for free, but it's not related to the services we're giving you. Gray area. So if it's not super clear, it's not meant to be clear. I wish I could give like a better suggestion on that, but that's kind of where we're at with it. But it's kind of set up this way because they don't want people circumventing the entire, regulated program. You can't just, set up a website and say, I'm a psychedelic facilitator and, I work with mushrooms and come see me. You have to actually go through the whole license pathway. So in practice, the sort of legal recommendation, although it's not very practical, is to grow your own or source them from somebody else. And I'll share kind of some info at the end about where you could possibly source some. So kind of switching gears, as I mentioned, there's two pathways, personal use, and then this is the regulated access program. And essentially this sets up licensed healing centers. You can become a licensed facilitator. There's also cultivation licenses for people that want to grow and supply the mushrooms, and other licenses as well. It's written very clearly that clients need to receive a minimum of the prep session, administration or medicine session, and the integration session. So as Shannon kind of talked about, that's the kind of typical model we see. And if you're going to work with them at a healing center, that's how you would do it. All right, so if you want to become a facilitator, you will need to do all of these things. So the first big one is go through an approved facilitator training program. This is 150 hours of didactic material. So it's quite a lot, and the state has outlined, what the exact subjects that need to be covered are, and different training programs will have submitted their application to the state to become approved. I'll also provide the list of current approved training programs. You also need to complete 40 hours of supervised practicum in the facilitation of natural medicine, and receive 40 hours of consultation from a licensed facilitator or basically somebody who meets similar requirements. Okay, text heavy slide, but don't worry, I'll break it down. The important thing here is that both a facilitator and a clinical facilitator do the same training. So those training requirements I just outlined are the same. If you want to become a facilitator, you don't have to have a clinical license. So you would complete all the training and become a licensed facilitator. But every client who goes through this process will complete a screening. And if you're going to work with them as a facilitator, they just have to show that they don't need additional medical and behavioral support. And of course, as a facilitator, you're still not allowed to practice medicine or psychotherapy. The difference of a clinical facilitator, again, you go through the same training, but you can obtain this one if you have a secondary clinical license. So all those license types are listed. Importantly, if you're an LPCC like myself, that doesn't count. You would need to be fully licensed, in my understanding, and there's also medical licenses listed there as well. The secondary licensure has to be current and up to date. And in this case, you could provide natural medicine sessions to treat physical or behavioral or mental health problems that fall within the scope of your secondary licensure. So like if you could already treat depression, now you can use mushrooms to treat depression. Okay, so kind of how this works is the first step is to complete the didactic portion, and then you apply to receive a training license. You also need to do basic life support training, which is pretty easy. And then a 2-year period opens up where you will then complete 40 hours of practicum under the supervision of a facilitator, a clinical facilitator, or I think also people that are licensed to do this in Oregon could serve in that role as well. And you need to complete 40 hours of consultation over a minimum of 6 months. That's a lot of consultation hours if you ask me. But this is, just questions about ethics and practice and other things. So when obtaining your practicum hours, this gets a little bit confusing, but like I said, there's 40 total. So essentially, let's say you're in like a 1 year training program, doing your didactic hours. Well, once you complete the first half, you can start getting those practicum hours. But you can only get 20 hours total. So essentially, in the second half of your didactic training, you can get the first half of your practicum hours. And then out of those total 40 hours, 30 hours of those need to be in person, observing or experiencing or actually conducting medicine sessions yourself. So the other 10 hours can be done virtually. Those can include the prep, integration, or even consultation. And then, so again, 30 out of the 30 out of 40 total hours, 10 of those can be the student taking or experiencing psilocybin. So like if I did the 40 hours total, I'm just repeating myself because this is kind of confusing. I could do 10 hours of those actually experiencing psilocybin myself. So maybe like two psilocybin sessions. But you're not going to get all 40 hours doing your own, psilocybin yourself. You need to be doing psilocybin sessions with other people, whether you're doing it yourself or kind of like shadowing somebody. Those practicum hours must be completed at a Colorado healing center or at an Oregon service center, which is kind of Oregon's equivalent. Um, and as you may be aware, there's a lot of things that are kind of still in process. So less than 2 weeks ago, on January 1st, the applications for licensure opened. So this is all super fresh. And there's still some concerns that the community has, things we're wanting to tweak about the program. So one of those changes was that anything more than 2 milligrams of psilocin, which is going to be about 0.2 grams of dried psilocybin mushrooms, basically anything bigger than a microdose. You have to do the preparation session at least 24 hours in advance with a maximum of like 60 days. So you're not going to do, a preparation session and then do the psilocybin 3 months later. That's too far apart. But less than 24 hours is too close. And you can imagine a scenario where somebody's kind of like prepping somebody and then going right into the administration session. So my understanding is we're preventing that. And then any doses that are less than 2 milligrams of psilocin, again, this is kind of going to be your typical microdose, are exempt from that requirement to do the prep session 24 hours in advance. But sort of awkwardly, you still have to go into a healing center. So like, this gets into kind of some of the January 14th stakeholder meeting changes. It's kind of awkward. I would say if you want to microdose, then do it under the personal use pathway. You can do it that way. But I've heard like people in Oregon, for example, will come into a service center and take a microdose and like do a breathwork class or something, and then they can leave after like an hour. Right now, there's still a minimum session length of 3 hours, even if you're doing that teeny tiny amount of psilocybin. So the community is trying to lower it to just 1 hour. So I think in that scenario, you could let's say come in and do like a therapy session and take a microdose and leave at the end of the therapy session. So another important consideration is that you'll have to do 20 hours of CEUs every year for facilitators. It's quite a lot. So just be aware of that. And then again, on January 14th, which is in just a couple of days, there's another stakeholder meeting where the community is kind of bringing some concerns, things they want to see changed. One of the big ones is the only way that you can do an at-home administration session is if it's for like palliative care, end of life. However, you have to be like an end of life kind of specialist. There's some additional requirements around that. And people in the community are concerned this is too restrictive. You could imagine, for example, somebody that has severe mobility issues and can't leave their house. They still want to allow in-home administration sessions for those types of people to just open up accessibility. And then one other proposed change is that normally if you're doing group psilocybin work, it's a 4-to-1 ratio. So 4 participants to 1 facilitator, and they're trying to raise that to 8 participants for 1 facilitator if you're just doing a microdose. So the way this was originally written, they didn't even really think about or talk about microdoses, and kind of now people are like, well, we want a microdose. So trying to make some changes to allow for that. So I'm not going to talk a lot about healing centers. Just know that under this pathway, this is where these sessions typically occur. And I wanted to include this slide because importantly, they have established what's called a micro healing center. And this was in response to a concern by the community that there's like super strict security requirements. So people that had like individual single office private practices were not going to be able to practice, to open a healing center at all. Because like you'd have to keep the psilocybin in a separate locked room, for example. Maybe you don't have a second room. So in response, they created a micro healing center, and the intention is for private practices or a small group practice to allow, like for example, this building could be a micro healing center to allow that to happen without having to go through all the super stringent security requirements and licensing fees. The only restriction is that you're only allowed to have a maximum of 750 milligrams of total psilocin, which is approximately 75 grams of dry weight psilocybin mushrooms. That's, in my opinion, for a small group practice, more than plenty. It'd be like 15, 20 maybe psilocybin sessions, and then you would just have to restock. So it's not totally prohibitive.
Maybe people don't know though, you will have to do psychedelic or therapy in a healing center. No, so that is the piece of that, is that in order to do therapy with mushrooms, you're going to have to be in a healing center. So you could have your clinical licensure, but if you don't have the licensure for the healing center, you're going to have to go somewhere that has that licensure.
That's right. Yeah, and I'll get into that a little bit more on this side as well. The fees just dropped, so we know what they are now. People were concerned. Yeah, sorry, it's very tiny. Yeah, for sure. Yeah, I'll tell you what the numbers are after I do a little explaining. And again, I'm happy to provide these slides. We just got the tiny projector yesterday, so we weren't sure what it would look like. So important to know if you're not familiar, DORA, the Department of Regulatory Agencies, they kind of oversee licensing. And my understanding is that the Department of Revenue kind of oversees like facilities. And maybe I have that wrong, but that's how I keep it in my head. So as I mentioned, you need a training license. And before I say the numbers, let me also say that these fees are likely to go up. So you have to understand that this probably never would have passed if the taxpayers were paying for it. So the program is all funded by these fees alone. So if these fees seem way more than like maybe what you had to pay for your medical or clinical license, that is because these fees are funding the entire program. And again, like people were like, I'm not going to be able to to apply if this is like $10,000 or something to get started. So they lowered the fees in year 1 to allow people to get going. but you'll have a yearly fee. So the training license is $420. Again, that's the first license that you receive, kind of after completing the didactic. And then once you complete the practicum and consultation, that'd be $840 for a facilitator, $970 for a clinical facilitator. Don't worry about distinguished educator. This is like university professors that have been doing it for 10 years. Maybe that is you, but I'll leave that for a separate talk. And then, so those are the fees that you pay to Dora. And you'll also incur some fees from the Department of Revenue. So a micro healing center is $3,000, again, year one. Healing centers are $6,000. And then also you'll have to pay for one of those Department of Revenue licenses as well. So if you're the owner of a healing center, you'll have to pay $750. If you are a facilitator that owns a healing center, you have to pay $500. If you're a facilitator that handles medicine, it's $250. And then if you're not a facilitator and you handle the medicine, it's $350. Any questions about that? I just want to leave some space because that might be confusing.
Yeah, the micro healing center is 3,000, and then if you work in the micro healing center, then you have to pay more.
Yeah,
Right.
I think so. I think they will
Okay.
kind of stack. You could imagine a scenario where you're working at somebody else's micro healing center, and so you wouldn't have to pay that. But like, let's say you're a clinical facilitator working at somebody else's micro healing center, you would pay the $970 for the clinical facilitator and then the $250 for a facilitator handler license. But if you open your own micro healing center, you pay for the clinical facilitator license, you'll also have to pay for a facilitator owner license. So that would be like, yeah, like 4,500 total for the micro healing center, the owner and the clinical facilitator. Yeah, so it's pretty expensive. And when you think about like the training cost, you're talking about $5,000 to $10,000 most of the time. For both the didactic and then usually what a lot of people do is they'll host like a 1 week kind of retreat style practicum where you go in, you take a lot of psilocybin, you facilitate a lot of psilocybin, you knock it out in like 7 days. But you're talking about paying for your overnight stay and your meals and your flights. So that can pretty easily get in the $4,000 or $5,000 range. And then depending on the program, just the didactic training, I've seen kind of as low as 4,000 and up to 7,000. So those are things to think about. You have to also think about getting insurance for this, which is costly because we don't have enough data. So yeah, it's a lot. I mean, I was talking to IPI about getting trained, and they said it was going to be, I think, $12,000, and they were going to put me on a payment plan. I was like, I can't afford that. So I'm waiting personally to do my training. I'm going to let other people be the first one to jump, and I will follow suit later on. So yeah, just be aware it can be costly. So these are a list of the currently approved training programs. These are all available on the Dora Natural Medicine website. If you Google Dora Natural Medicine, you'll find their homepage. So where to get started? Let's say you're maybe new to the world of psychedelics. And you don't want to pay all those expensive fees that I just named. Some ways you can start to experiment and learn. Growing your own mushrooms is one. I'd say it's fun, easy, and cheap. It's like a fun little hobby. You have to learn a little bit. But when I did it, I only paid like $140 for all the materials. I went to Orion's Apothecary in Loveland and got a kit. I grew them that way, and it was pretty easy. And then a lot of people use a method called PF Tech. I would say if you're planning to grow a lot over time, maybe do that because it's more sustainable, but there's a lot of equipment and stuff you need. But this is a picture of mushrooms I grew myself. I actually brought them. And if you want some, I'll give some to you. So stay after class for the free gift. Because I literally have them growing out my ears. I have like so much of them. And so I was like, I wasn't gonna do that, and I thought this morning, well, why not? So if you want some, you can have some. If you're virtual, email me and maybe drive up to Fort Collins, I'll hook you up. Yeah, so that probably sounds crazy, but like it is legal, and that's the kind of like wild thing when you think about it. Like, although I will say these are still federally illegal, just like marijuana, there's Schedule 1, but like nobody's, the DEA is not knocking down people's doors in Colorado for smoking weed in their own homes. And the risk of incurring federal charges is like next to none. But just be aware under the Controlled Substances Act of 1970, for whatever reason, inaccurately, they consider these to be highly addictive with no medical utility. So we're still working on changing that. Another option is to try microdosing. So I brought these as well, which are little microdoses, and this is, I always have a hard time opening the package for some reason.
It's not the package.
It's the package, right? So these have 0.1 grams of dried psilocybin. It's a pretty average kind of microdose size, I would say, and then 400 milligrams of lion's mane just for filler. And these are from a guy named Joe the Mushroom Man, who is local, and he's very nice, and he was a first responder, and he's been doing it for a long time. And I'll share his information. And he's got a website, as I mentioned. You can keep a website with educational materials. And so kind of what he does is he has a website, you fill out a contact form. You can mention my name or Shannon's name as a reference. And then basically you get on his educational sort of digest, and you're paying a monthly fee to access that. And then he hooks you up with some microdoses. Again, this is one of those areas I would consider gray area. So that's why I say this is not legal advice. I would say if you really got down to it, that's not how the law is written to be done. But, everybody has a different risk profile. I'm a libertarian when it comes to drugs. So like, do what's comfortable for you. So you could also do a small dose of psilocybin mushrooms. I emphasize in a safe environment with a loved one or trusted person. Be very mindful of those things. I don't imagine any of you will have concerns with that, but it's just important to note. And then also I recommend staying under 3 grams of dried psilocybin mushrooms for most people. It does vary by person, so maybe you're fine with more. And some higher dose strains, such as the interestingly named penis envy, have a very high psilocybin content relative to others. So the amount of actual psilocybin in the mushrooms can vary quite a lot. So 3 grams of those is going to be very different from 3 grams of golden teachers. But ones to stay away from if you're not wanting to blast off are the penis envy or albino penis envy. They call them apes. Something like golden teachers is going to be more mild. B plus, which is what those microdoses are more mild to moderate. And the ones I grew are called Z strain, also pretty moderate. So just be mindful of those dosing considerations, because you can blast off way deeper. I'm speaking from experience than maybe you want to go. So just, be mindful of that. You can do a ketamine experiential, of course. Here at the ICC, we hosted a ketamine group with like 10 or 12 people. It was all free. Probably not going to be free in the future because it was a ton of work, mostly that Shannon did. But sometimes there are those opportunities available to experience ketamine in a kind of therapeutic container. You could do a course of ketamine-assisted psychotherapy. Several CAP therapists in this room, or do ketamine-assisted psychotherapy training, where you'll learn more and possibly experience it. You could also attend our community psilocybin circle. So this is coming up in just a few weeks on February 1st. It's led by a team of 3 very experienced people. Tracy, who's in the room here, she's been working with psilocybin for a couple of years and works with ketamine as well. Gail, who was my previous clinical supervisor, she went through the entire clinical facilitator training and has been licensed for like 30 years, so she's amazing. And Shannon as well. I was going to do it, but since I got a new job, I'm tied up. But 3 people for 3 facilitators for 8 people. You'll be very, you'll get lots of attention and protection because that's a really nice ratio. So you do need to be an ICC member, but as I mentioned, it's free to join and it's very easy to do so. So if you're not, go to our website, which is on the slide there, or scan the QR code. We make it super accessible to join the ICC, so we're not putting any paywalls up. The community rate is very affordable at just $400. Not to compare, but a lot of people charge way more than that, which is fine. We're just kind of doing it at a rate that's affordable for our community members. And we have 1 pro bono spot. So if you can't afford it, that's totally fine. You can join for free. And there will be 8 people maximum. Again, it's on February 1st. There is a medical evaluation from Shannon. There is a preparation session on Zoom, a full day ceremony that's like already worked out. It's going to be amazing. And an integration session for 2 hours the next morning. So it's very, very well set up, if you ask me. And we're operating legally under the personal use pathway that I mentioned as well. So reach out if you're interested. We're asking for a $200 deposit by January 20th, and that's to give Shannon enough time to reach out and do the medical evaluation. Also, if you know somebody who would be interested in doing it, let us know. We've got a few spots left. So I've been asked this question as well, like what if I have a client who's a good fit for like psilocybin, but I don't feel comfortable working with them, who can I refer them to? So like I mentioned, it's been less than 2 weeks since the applications open to have a healing center. So I just heard that we might see them in 6 to 7 months. So keep an eye out. Just do a Google search. I can do psychedelic integration therapy and private practice. I'm happy to do that. It's a specialty area of mine. But I don't currently have the space to do proper psychedelic sessions. We could probably find you somebody if you reach out to the ICC though. Also reflective healing, which is owned by Dory Lewis. She also does the elemental psychedelics training. Her website lists that she does it. Again, like a note to be careful about putting stuff up on your website, but they've accepted that risk tolerance, so I'm fine with it. And medicinal mindfulness, who's in Boulder, also listed available currently. So the resource for microdosing, as I mentioned, the ones I showed, that's mind-quest.com. Legal advice, I really like these people, Antithesis Law. My friend Matthew Brockmeyer, Shannon and I have known him for several years. He's super knowledgeable about this stuff. He's done work for the ICC a couple times and has gone way above the bar for us, so I really appreciate him. And Jody Green is another fantastic lawyer, and they have another lawyer there, I don't know his name though. But a lot of people recommend Sean McAllister. We've worked with Sean and he's great as well. But I feel like everybody sends work his way. So I'm like, go to these people, help them out and they'll take care of you. And then just make sure, like I said, to check out the DORA website on natural medicine to view the currently approved training programs. If you complete the didactic, apply to be a facilitator there. They also just released these really great informational PDFs that break it all down super simple. So go there and check those out. Okay, I'll leave room for questions. I'll just let y'all know first though. Here's our references. And the contact information is available there as well. Again, we've got cards in person. But that's my private practice website, Shannon's private practice website, ICC website, and both our emails. Okay, any questions? Yes.
There's one slide there about the 2-year opens. You know what I'm talking about?
Yes, I do. Yeah.
But it doesn't
They
take
have
2
2
years.
years to complete, like,
Oh,
your,
I see.
Yeah.
um.
I'm not sure if it's like a hard stop, like if you don't get it in 2 years.
Oh,
But that's just what it says in, in the regulations that a 2-year period will open to start accumulating those. I know because in the past I was concerned, like if I don't get all my LPCC hours in like 3 years, they were like, you can never apply again. It's one time. I'm like, why would you do that?
no.
And then they just actually changed the regulations so that LPCCs can reapply, basically renew their LPCCs. So I feel like that's really harsh to be like, if you don't do it in 2 years, then you never get to do it again. It's like, what? So anyway, sorry, it's not super clear, but yeah, I think if you get it all done in 2 years, you're good. And then it's just a minimum of 6 months for the consultation hours.
I
Aaron?
was also gonna recommend Christine Peel in Loveland for microdosing. Really,
great.
really great. Christine Peel,
Yeah.
THIEL.
Yeah, it's hard if you don't have like a good person or resource for microdoses,
And local. It's
Mhm.
nice to be able to
right?
face to face.
Thank you.
CH.
And I think, did you put Joe's info on there, really like that for the microdosing?
Right.
So that's been great. My other question around that was, I feel like personally, I have a lot of benefit from microdosing.
Mhm.
My piece has always been trying to find research, because it really, I feel like
Yeah.
it hasn't. Does it really have any good recommendations?
Fadiman, James Fadiman is the kind of leading microdose expert. He's got some podcasts and then he wrote the book on, what's the?
Psychedelic Explorer's Guide.
Yeah.
I think he's about to publish a book on
Yeah, actually he
microdosing.
is, that's what he said, so he's gonna come out with a new book just on microdosing too, but he's a doctor. And has a lot of really great information, and he sent me an email one time.
Fadiman, yeah, and he sent Shannon an email one time, which she fangirled about super
Such
hard.
a fangirl of him. He's like 70s. He's done a lot of really, really cool work, and he's the first person I listened to like scientifically talk about psychedelics, and I was like, so he's probably got the most scientific talks and information about microdosing.
He's like one of the old school microdosing guys. There's his protocol and Paul Stamets protocol if you're looking for microdosing protocols. My understanding, and maybe it's changed, there's not a lot of high quality research, and so I kind of like put aside microdosing for a long time. Because I actually heard at Psychedelic Science in Denver a couple years ago, like one of the great, scientists David Eritzo talking about it, and he showed this like almost like Christmas tree graph of like the microdosing studies, and like basically the more rigorous like control, like once you get into the double blind clinical trials, the like basically you can't distinguish from placebo. However, like on a personal level, like I found them super helpful. So I microdosed for a few months. And it was great, and Shannon will confirm for me. It was very helpful.
And
Yeah,
clinically, I've seen too a little bit, I've seen some help with autism and anxiety. That's a real booger to work with. Like medicines I have not found helpful because there's so many other side effects that actually help. And so I've seen a handful of people on the spectrum that have that anxiety that just is hard to find anything to work with that microdoses have been super helpful for. And you know, something I wanted to talk about and I didn't throw in there, and I will go on my soapbox a little bit here, is just that a lot of what we talked about today and what is coming out and the regulations that we're trying to figure out do not fit in our conventional model. And so there is a lot of like language we're trying to figure out, and they worked really hard on the Natural Medicine Health Act to try and bring in like we've been having indigenous cultures have been working with these medicines for thousands of years. And so we don't necessarily have the full understanding of the breadth of how that they can support us. And so we are trying to conceptualize it in this model that we have now, and it probably isn't going to work. So there's probably going to have to be some shifts and changes on both sides of that. And it's a transition, and it's hard and it's messy. So I just want to name that and say that there are also a lot of benefits that we can't put into a double-blind controlled study or randomized controlled study. So yeah, it's helpful to share and support each other with information and like what we're seeing in practice as well.
and I didn't talk about it, but there are pathways where Indigenous legacy healers can bypass these training requirements. I mean, they do have to kind of fit into our model a little bit, which I know is difficult, but like if they've done, I think it's like 200 hours of sessions over like 5 years. There's a lot of people out there doing that.
And
You
it's
know,
not for us to try and figure out how to do that and find our way into it. It's those people that have legitimately been using these medicines in their culture before.
Yeah, with the indigenous.
Yeah.
just to say,
Underground.
right, yeah, just to say that the Natural Medicines Health Act authors are not totally blowing off, indigenous healing, but there's a lot to kind of try to fit this into our Western paradigm or change our Western paradigm, but it gets a little sticky.
There's also an accelerated path.
Yeah.
For people that have already done a bunch of training and are doing this work. That's
Yeah.
what I'm doing, and I think it.
Through
I think
elemental.
Yeah, I think it drops like 50 hours.
Yeah, if you can demonstrate that you've done similar training, they'll kind of waive the requirements, so and I'm not exactly sure how that, they'll waive certain
Right,
requirements.
sure.
And then, so I didn't talk about that as much, but if you're very experienced, you can either waive or bypass a lot of the training. Other questions?
I have a question / comment. Did anybody see, I don't subscribe to the Colorado one, so I can read it, but they did an article, I think this morning.
Oh.
I just saw it come out on healing centers. And they said that like 3 towns or cities, it sounded like we're banning, I don't know, I didn't.
Yeah.
Springs was probably, is that one of the city limits, they don't want
it, I was just curious if anyone had tried.
A little
it.
bit of-
I know that Brayley's really particular too.
Okay.
That won't be us.
No, not here. There's a little bit of butting heads going on there, with municipalities. Yes.
on that line, like you mentioned that kind of is an example when you're talking about the micro healing center, you kind of like reference to this building is. Your understanding with the current pathways there, that even for someone else, like not me, not anybody who works in this building, to facilitate a psilocybin session legally in this building, we would have to be have that micro healing center.
Yeah,
So even if I personally wasn't doing a psilocybin session in this building, but I wanted to make this a space that could be allowed.
yeah. You would,
Even if we will use the space, we would have to get that.
Yeah.
either you could do it under the personal use pathway. But yeah, if you wanted people that are like clinical facilitators to facilitate their sessions here, you would still have to have the micro healing center, license for this facility.
And so under the personal use, if someone's bringing their own mushrooms and there's just a ceremony or something happening here, that's still allowed.
Yeah, that's right.
Semantics, yes.
Yes, Kelly?
Is the in either of the ketamine assisted providers or
Yeah, good question. There is not a specific protocol. I mean, people can do ketamine on their own at home, right? I will give you what my opinion is. There's a Journey Clinical actually put together a really good policy. I think, not all their policies are great, but they say for a virtual ketamine session that the therapist is on a Zoom watching the participant, and they have to have a chaperone in the same building that the therapist is in communication with. So I did practice this, and I had my client on Zoom with me or on my virtual platform, and then I texted the person that was there. I got confirmation they're in the place. We have this, like, we can get a hold of each other so that if something happens where they're at, a fire, an emergency, that person can get the person out that's on ketamine. Or if I see something that I'm concerned about, they can go check on them and we can communicate. So while there isn't any specific guidelines, that one Journey Medical came up with, and I'm grateful because I think it is helpful. It does make it more accessible, and I've had some therapists really need to use that for access for people. I always recommend, I think the best practice is being in person with somebody, and especially for an initial ketamine session, you don't know how somebody's going to react to the medicine. But that does give you the flexibility, especially if you've done 1 or 2 sessions with somebody, that you could maybe open it up to a virtual visit that feels safe to me. That is going to be also what feels safe to you and what feels safe to the person prescribing the medicine is a huge piece of it. So, yeah, that's.
I've done several of those for Journey, and I was pretty comfortable doing the initial session in my office, and so they would be all over Colorado or whatever.
Yeah.
I like doing the initial session in my office, and
Yeah.
then, I just have them drive in, and then the rest of them were okay, but it's kind of weird to do that initial session when you're kind of checking everything out and figuring out dose and how they react. It's weird to do it online.
Yeah. And I hinted at it, and this isn't by any means a requirement, but there is a ceremonial aspect to using these medicines. It's not just clinical. People aren't just taking a medicine, you're watching them and they're going home. There is intention built into going into that medicine space and how you come out. So you have to take all that into consideration. And maybe you don't, maybe you just want to practice very medically with it. But from my perspective, that's a piece of it. And, that's another thing I didn't get into, and I don't know if I want to go off complete soapbox, but the other benefits, like we talked about, the hallucinogenic effects being sort of a side effect by kind of our Western model. Part of that is experiencing a connection with something outside of ourselves, whether it's the earth or the divine or just spiritual connection to ancestors or other people that can't be really explained. And that is part of the healing properties of these medicines that we don't we don't have a framework for in our conventional psychiatric models right now. So just a little side note of that piece.
Change society to allow for this proper, that's a bigger thing. Yeah.
I have noticed that with people that, this is gonna get really woo here, but to me, I consider it a spiritual practice with clinical skills, you know, and it's kind of like they're introduced to this different level of being,
Mhm.
but then as I work with them over time, they have more synchronicities in their life. They're manifesting things, you know, all that woo stuff.
Right,
And it's really interesting. It's way more than just, here's a journey, here's some therapeutic goals and all this stuff, but
right,
they're waking up to a new part of themselves and the world, and it really, really, really shows over time. It's so cool. Yeah, it's cool.
yeah.
It's exciting.
It's what excites me about it as well. I've been doing all this CBT and DBT stuff lately, and I'm like, this is very valuable, and I get why. And I missed a lot of that in all my psychedelic type training, but I'm like, also like, we need to be bringing in kind of the spiritual and that deeper work. So that excites me a lot as well. Other questions?
I had a question, is like, as a therapist, before we send somebody to a prescriber, specifically, what should we be looking, who would not make a good candidate for ketamine specifically? And specifically around dissociative identity disorder?
I'm gonna say that is going to be something you probably kind of learn more about in a training program, because that is very extensive. And I'm gonna say it's very individualized.
That's what yes, because even my training program, a lot of people say no personality disorders, or my training program is not like through the psychedelics, not even they're like, I don't see why not. Would some of their
exactly.
experience.
Yeah, different. I think that comes down to like getting to know the client, right? Like you do a very thorough intake with them, or know them, you've seen them over time, and you see their patterns, you know them, you understand them, and really feel whether that it feels like it would be good to move into. Maybe a prescriber, you also develop a relationship with a prescriber that you can have that conversation with.
Sure.
So I'm not going to give you a for sure answer on either of those.
Okay.
But say that, you know, your training program would give you a lot more in-depth information about what, you know, would be that. And then also that relationship with your prescriber, or, you know, who knows what it's going to look like with mushrooms. I don't know how that's going to look, where we're going to be left in that, but also consultation with people.
Sure.
And so, yeah, I'm happy to consult more on that, but especially DIDs, like I am not a DID expert. And I'll just say ketamine, while it's a dissociative, I've also seen it put people in their bodies. So
Could be the magic pill, could make it way worse. Like,
It literally thought in my head, somebody asked, I'm like, I could see that going either way, actually.
and that's why the model is so important outside of just the medicine, right? Because you're integrating and checking in with your client, and you're seeing what's coming up for them. And if it's making worse, then you're doing that work with them, or you're sending them to a higher level of care and stopping, or maybe you are going back in and doing deeper medicine work to keep moving through that. So having relationships with your clients, having relationships with other providers and people that are working with the different medicines is super important.
one more comment, sorry, and then I'll let you go. I'll just say, I know I am far from a DID expert, but I know it's also rooted in deep trauma as well. So maybe, yeah, go ahead,
I
Sarah.
was just gonna say on that note, the person, people with DAD or a dissociative disorder of some kind, on average, spend 10 years in therapy before they just even finds that. And so even if we wanted to say, oh, for something like ketamine, this might be like something to be cautious with, or like tiptoe really carefully before you're. The truth is, if you don't know really how to assess for dissociation, even if you wanted to intentionally say, I don't wanna do this, you can, yeah, so my point in saying all of that is learn how, I mean, I think it should be standard in every
Yeah.
mental health license to learn how to assess for dissociation, but I got like almost 0 in my program, and it was something that I only really got because I ended up in an internship with someone who had that specialty and who taught me how to see it, and so I would say, there's a free talk that Drina did, with her groups that's on our website. You can find it. So at least
Great.
do that 1 hour thing, but consider doing one of Drina's trainings where she's like passionate about helping people learn how to see it and understand it and how to treat it. You know, that it's not just this thing like, oh, well, somebody dissociates, now they can't do jar, they can't do psychedelics. They probably can if you really understand what's going on.
Wow.
And so her goal is to like help people learn how to assess it and guide them through learning how to treat people.
Great point.
Please
We're
learn.
at the end of the time, so I'm gonna end the Zoom, but we'll hang out for like another 30 minutes or so. If y'all want to continue discussion or ask us more questions or talk one-on-one. Thank you all so much for coming.
Thanks.
Yes. Okay, thank you, virtual people as well. Glad to have some of those. Stop sharing.